thinking about saying goodbye to breast implants. You're not alone.
Not at all. It seems like we're hearing about it more and more these days.
We really are. So today's deep dive takes us way beyond the surface level,
Yeah.
We're diving into the nuances of breast implant removal.
The real nitty-gritty.
Exactly. And to guide us, we have insights from Dr. Surjit Rai, a board-certified plastic surgeon in Dallas who specializes in this.
He's got such a great approach, very patient-centric.
He really does. His insights are honestly eye-opening. So let's get into it. Why are so many people choosing explants? Is it just a matter of changing their minds about the whole, enhanced look?
Well, that's definitely, a factor for some. Tastes change, lifestyles evolve. It's natural. But what we're seeing more and more are women seeking explants for medical reasons, and some of those can be, shall we say, a little less obvious, at least until you start experiencing them yourself.
Okay, give me an example. What's something that surprised you when we were, digging into all of this?
Well, capsular contracture, for instance. I feel like most people have heard the term,
Right.
but until you understand the lived experience,
Yeah, what it actually feels like.
it's hard to really grasp the impact. So imagine this. Constant squeezing, almost like your implant is being strangled by your own body.
Whoa, that is intense. So it's not just about the way it looks, it's actual discomfort.
Exactly. Dr. Ray describes it as this feeling of tightness, sometimes even pain.
Makes sense.
And in some cases, it can even cause like a visible distortion of the breast. It's your body's natural response to a foreign object. But sometimes that response, it goes into overdrive.
And then there's the whole implant rupture situation, which honestly freaks me out a bit. I mean, we're talking about something literally breaking inside your body.
Oh, for sure. It's a valid concern.
Yeah.
And it really highlights why, understanding the differences in implant types is crucial. With saline implants, a rupture is usually pretty obvious.
Yeah, it just deflates, right?
Yeah, it deflates, your body absorbs the salt water, you know something's
Right.
up.
But with silicone, different story.
Totally different story. Silicone gel is much thicker, so it can leak out really slowly, sometimes for months, even years, without any noticeable symptoms.
Wow, so you would have no idea.
Exactly. This silent rupture, as it's often called, is why regular MRIs are just non-negotiable for anyone with silicone implants.
Oh, yeah, that makes total sense.
Dr. Ray is very adamant about this. Early detection is key.
Makes sense. It's like you might not even know there's a problem until it's a much bigger problem.
Yeah.
Okay, so we've got aesthetic changes, we've got capsular contracture, we've got ruptures, and then we get into this whole breast implant illness thing.
And this is where things get really interesting because BII is still something of a medical mystery.
Right.
We know that some women experience this whole constellation of symptoms, fatigue, joint pain, brain fog, even anxiety and depression.
Things you wouldn't necessarily connect to breast implants.
Exactly. But for these women, the improvement they experience after explant, it can be profound.
Why?
Yeah. It's like their bodies were trying to tell them something was wrong all along.
It's almost like a relief in a way,
Yeah, like a weight lifted, literally.
Exactly. Okay, so let's say you've made the decision to explant. What can you actually expect from the procedure itself? And what happens afterward? I feel like there's a lot of mystery around that.
Yeah, it's a big question mark for a lot of people, which is understandable.
Totally.
And that's where I think a skilled surgeon like Dr. Ray really makes a difference. He's incredibly detail-oriented, not just in removing the implant, but in addressing the whole picture.
Speaking of details, what's the deal with this whole capsulectomy and en-bloc thing? It sounds kind of intense when you see it written out.
It always sounds more dramatic than it is, I think.
Right.
So remember that scar tissue capsule we were talking about?
Sure. Yeah.
A capsulectomy is basically just the removal of that capsule.
Okay.
And en bloc just means they're taking it out in one piece with the implant still inside.
Got it. Okay, so why not just remove the implant and leave the capsule? I mean, that's less surgery.
You would think so, but it's not that simple, unfortunately.
No.
Dr. Ray, and this is, again, where his commitment to going above and beyond for his patients really shines through.
Okay.
He insists on removing that entire capsule for a couple of important reasons.
I'm intrigued. Lay it on me.
First, it significantly reduces the chance of any, stray bits of scar tissue sticking around, which can cause problems later on.
Yeah.
But here's a really interesting part. Dr. Ray sends every single one of those capsules to pathology to be analyzed.
Wait, they test the scar tissue? I had no idea.
Standard protocol in his practice.
Wow.
But you're right, it's not something that every surgeon does.
Interesting.
And it makes perfect sense when you think about it, because it's an opportunity to detect any potential issues early on They're also specifically looking for signs of BIA-ALCL, which, while rare, is a serious concern, especially for women with those textured implants.
So it's like a 2-for-1, removing the implant and getting peace of mind at the same time.
Exactly.
Okay, now let's talk about the aftermath. Once the implants are gone, what happens to, well, your chest? Asking for a friend. Does it just go back to how it was before?
That's the million-dollar question, isn't it?
Right.
And unfortunately, it's not always that straightforward.
Okay.
It depends on a lot of factors.
Yeah.
Your age, how long you had the implants, your natural tissue.
So everyone's journey is different. What are some of the things that Dr. Ray prepares his patients for, like realistically?
Well, one issue that he often sees is what's called upper pole deflation.
Upper pole deflation.
Yeah. So basically, after having an implant stretching the skin for years, the upper part of the breast can look a little,
It's a little sad.
yeah, we'll go with sad. You've got all this extra skin now, but nothing to fill it.
Makes sense.
Right. And that's where Dr. Ray's approach to things like fat transfer comes in.
Okay, yeah, fat transfer. That was another thing that kind of caught my eye when we were going through Dr. Ray's material.
It does sound kind of futuristic, right?
It sounds like something straight out of a science fiction movie. So you're telling me they can just take fat from, like, my thighs and put it in my breasts?
Yeah, that's the basic gist of it, yeah.
That's wild. But if I'm being totally honest, the idea of, like, transferring fat to my breasts after having implants removed seems, I don't know, a little counterintuitive. Like, why wouldn't you just do it all at once while you're already there?
That is a great question.
Yeah.
And it really speaks to, I think, Dr. Ray's kind of unique approach. He found that waiting a few months after explant to allow the breast to kind of settle into their new normal actually leads to better, more natural-looking results in the long run.
That's interesting. So it's about being patient, letting your body do its thing.
Exactly, yeah, before making any other, like, drastic changes.
And speaking of letting the body do its thing, one of the things Dr. Ray addresses during explant that a lot of people don't even realize is an issue is muscle shortening.
Oh, right, yeah.
Muscle shortening, what is that?
So when you have implants in, especially for a long time, the pectoral muscle underneath can actually shorten and tighten. It's like it's constantly flexed, even when you're not doing anything.
I'm trying to imagine that, and my chest is starting to seize up just thinking about it.
Yeah, it can definitely cause discomfort, and it can also affect how your breasts look, even after the implants are gone.
So how does he address that?
So during the explant procedure, he carefully releases and lengthens those shortened muscles, which allows them to relax back into a more, like, natural position. It's a subtle step, but it's an important one because it can make a huge difference in both comfort and aesthetics down the road. It's all about restoring that balance, that harmony.
It's amazing how much thought goes into all of this. You're not just taking something out, you're really trying to, like, reset and restore the entire area.
Exactly. It's about addressing not just, like, the immediate concerns, but the long-term health and well-being of the patient.
I love that. Okay.
And that actually brings us to, I think, a really crucial aspect of this whole journey, which is finding the right surgeon.
Okay, yes. Finding the right surgeon. That feels especially important with a procedure like this, where it's so much more than, just like a quick nip and tuck.
Absolutely. And you're right. This isn't your average, like, cosmetic surgery.
Right.
This requires a high level of skill, experience, and frankly, a certain mindset from the surgeon.
So let's say you are out there doing your research, trying to find a surgeon who's a good fit. What are some things you should be looking for, aside from, like, the obvious, board certification, all that jazz?
The basics, yeah.
Mm-hmm.
Well, Dr. Rai actually provides a really insightful list of questions in his patient materials. And some of them are real eye-openers, honestly.
Like what? Give me an example. What's something that, like, most people wouldn't even think to ask?
For starters, like, will you be performing my surgery or will it be an assistant?
Oh, wow.
Seems basic, right?
Right.
But you'd be surprised how many surgeons delegate these types of procedures.
That's a good point, though, because you're putting a lot of trust in this person.
Right.
You want to know who's actually going to be in the operating room with you.
Exactly.
Yeah.
And then there are questions about, like, what happens to the implants after they're removed?
Wait, can you keep them? Is that a thing?
It is, believe it or not.
No way.
Some people want their implants back.
I mean, I kind of get it.
Yeah. Maybe for sentimental reasons, who knows?
Right.
The point is, it's your body. And you have a right to know what's happening every step of the way.
I love that. It's all about, like, transparency and empowering the patient.
And informed consent. Dr. Ray is a huge advocate for making sure his patients understand every aspect of the procedure.
Yeah.
The risks, the benefits, the long-term implications.
That makes me feel so much better about this whole process because it's not just about getting what you want. It's about making a thoughtful, informed decision that's right for you.
Precisely.
Yes.
And it's so refreshing, honestly, to see a surgeon who truly embodies that
It
philosophy.
really is. It's like such a good reminder that it's not like one size fits all, you know?
Absolutely not. Everyone's body, everyone's journey is so unique.
So true. Okay, so for anyone listening who might be considering Explant or even just like curious about it,
Yeah.
where should they go from here? What's like the first step?
Honestly, just start by educating yourself.
Yeah.
And you're already doing that by listening to this, but don't stop here. Like, dig into those resources Dr. Ray provides. Explore reputable sources online. Talk to women who've actually been through it.
Yeah.
The more you know, the more confident you'll feel making that decision that's right for you.
And find a surgeon you trust.
Oh, 100%.
Someone who like gets you.
Yes. Someone who listens, who answers your questions thoroughly, and makes you feel like you're like an active participant in your own healthcare, which you are. Yeah.
Yes, which you are. So well said. Oh my gosh, this deep dive has been a wild ride. We've covered everything from capsular contracture to DIY fluffing techniques. It's incredible how much there is to know about something we don't often talk about.
It's like uncovering a hidden world, isn't it?
Right.
And it just goes to show there's always more to learn.
Always. All right, everyone, that about wraps up our deep dive into the world of breast implant removal. We hope you learned something new, gained a fresh perspective, and maybe even feel empowered to ask some tough questions of your own. Until next time, stay curious.